Good afternoon, everybody. My name is Katie Ensweiler. I'm the marketing manager at VonLehman CPA and Advisory Firm. A few housekeeping items. If you could, please keep yourself on mute and your video off. It will enhance the viewing experience for everybody else. Also, if you have any questions, please feel free to submit them in the chat box. We will do the very best we can to get to all of the questions, but if for some reason we cannot, we will be providing the contact information for our moderator and both of our panelists, and you can reach out to them for any follow-up questions that you do have. With that, I will go ahead and turn it over to Jami Vallandingham.
Thanks, Katie. Hi, I'm Jami Vallandingham, a shareholder here at VonLehman. We're happy to have both Nate and Michael with us today to talk a little bit about Social Security, and then with the Medicare that we have coming up for open enrollment, talk about that as well. So I'll let both of them introduce themselves and a little bit of their background before we get into the discussion. Michael, you want to go first?
Sure. Thank you very much, Jami. My name is Michael Hermes. I'm a financial advisor at HORAN. I'm a certified financial planner, chartered financial analyst, and national Social Security advisor. And so really what I specialize in all day, every day is just dealing with retirees and helping them transition into and throughout retirement, and essentially recreating income in retirement. But I'm happy and excited to be presenting on Social Security today. And then with me as well, I also have my colleague, Nate Epp.
Thanks, Mike. Appreciate it. Thanks, everyone, for taking your time today to join and hear about two really exciting topics, Medicare and Social Security. My name is Nate Epp. So I've been in the insurance industry about 15 years now, and I specialize in Medicare. And similar to Mike, we help a lot of folks that are approaching age 65 or they're approaching retirement, and just help answer questions, help them navigate Medicare. It's entirely too confusing, and we just help people make the transition. We review insurance options, and we remain your agent throughout retirement, and help change plans as needed. So thanks so much for joining, and we got a lot of information to cover today.
So typically in our panel situation, we kind of go back and forth between whomever's going to answer, but because we're kind of on different paths today with the discussion that we're having, we'll start with Mike first and kind of go through some of the Social Security things. We have some kind of frequently asked questions that they run into all the time that we'll go through. And as Katie said, if you have any other questions, feel free to throw those into the chat. She'll interrupt when necessary, or we'll just keep all of them to the end of each of their presentations. And then again, of course, we'll have an opportunity at the end for anything else that you might think of throughout. So Mike, we'll go ahead and get started. This is something that we hear frequently, and it keeps getting a shorter time frame on it. But is it really true that the Social Security system is going broke?
Yeah, so I hear that statement a lot of time from clients that I'm dealing with, where their whole mindset is, well, I'm not going to get anything from Social Security. And there's kind of a half truth to that. And so every single year, about $1 trillion comes into the Social Security system via taxes on your paycheck. And then every single year, about another $1 trillion leaves the system in the form of benefit payments. And so there's actually a little bit of a surplus in 2019. 2020's just came out, so I don't have the most recent numbers, but I know there's still a little bit of a surplus. But there's about a $2 billion yearly surplus. And that surplus goes into the Social Security Trust Fund. And that trust fund just sits there in reserve, earning interest, ready to be paid out to beneficiaries in case there's no more surplus and it starts operating at a deficit. And so it's projected that by next year, they're going to have to start dipping into that trust fund every single year going forward to continue paying beneficiaries 100% of their payment. And so without any sort of reform in the system, it's expected that by the year 2034, that trust fund will be depleted to zero, and then everyone will only receive 78% of whatever benefit payment they were promised. And that's without any sort of reform. And so there's a lot of different ways that they can actually fix the system. And so currently in Congress, there's a bill called the Social Security 2100 Act. If that gets passed, everyone will receive 100% of their benefit payment through the year 2100. And so the first way that Congress is planning on fixing the system is to increase the overall tax rate. right? And so, surprise. And so currently the first six, both you and your employer pay 6.2% Social Security tax. So what they want to do is raise that to 7.2% for both you and your employer over the next 25 years. So it's a gradual increase. And then in addition, on your pay, currently the first 147,000 of your pay, that's 2022's numbers, so 147,000 of your wage base is subject to Social Security tax. If you make more than that, there's no more tax. So what they want to do is incorporate a donut hole, if you will. You'll hear all about Nate and Medicare and donut holes with the drug plans. But essentially what will happen is if you earn more than $400,000 per year, the Social Security tax will kick back in. So that's the second way that they're planning on fixing the system. Increase the overall tax rate and increase the overall amount that's subject to tax. There is a third option, and I wouldn't be surprised if they start to pay a little bit more consideration to this as well. But currently, the latest full retirement age, which we'll talk about in a second, that is when you can collect 100% of your Social Security benefit, retirement benefits. That is age 67. So I wouldn't be surprised if they start to push that full retirement age back later and later to encourage people to continue delaying taking their benefits. But yeah, so there's a lot going on with the Social Security Trust Fund. And so we'll see kind of how it develops year after year. But if you're looking at your retirement planning, you should take into consideration that come year 2034, you'll receive roughly 78% of your benefit payment.
Thanks, Mike. Do you think, I know Congress doesn't have anything to do right now. Do you think that this is something that they're going to try to tackle here in, say, the next 6 months, or is this a longer term look for them and trying to get some sort of an agreement?
Yeah, that's a good question. I know there's been lots of talks about reform. I don't think anything has actually been proactively done for it. And so I think just like most things that they do, they'll continue to kick the can down the road until they can't anymore. So, we had an election in 2024, trust funds going, or 2020, trust funds going broke in 2034. So there's going to be election, I think, in 2032. So that's when they'll probably get around up to talk about it.
Great point. You're probably right. One of the other questions that comes up a lot is, can I still get Social Security? Can I claim Social Security if I'm still working?
Yeah, so there's a rule with Social Security that not a lot of people know about. It's called the annual earnings test. What that talks about is if you want to collect your Social Security benefit before your full retirement age. Once again, your full retirement age is when you can receive 100% of your Social Security retirement benefit. For most people, it's anywhere between age 66 and 67. Okay, it just depends on the year of your birth, and that is highlighted on page 2 of your Social Security statement, so you can figure out what your full retirement age is there. But with the annual earnings test, that talks about if you want to collect Social Security before your full retirement age and you are still working, the new numbers just came out, you cannot make more than $1,630 per month at your job, or Social Security is going to withhold $1 for every 2 you make over that threshold limit. Okay, so typically I know it's a little confusing, but typically what we see happens is you're 63, you retire, you start up your Social Security, and so 6 months goes by in retirement, and now you're bored. So you pick up some part-time work, and you end up making more than $1,630 per month at your new job, and then all of a sudden you get a nasty letter from Social Security saying they overpaid you benefits, and they're going to have to withhold the next 6 of your monthly checks. All right, that's typically what we see happen. And so there's an easy way to avoid this altogether, and that is to just wait until your full retirement age to begin collecting. So at your full retirement age, you can earn as much money as you want and collect your full Social Security benefit, and you don't have to worry about that happening. If you do collect your Social Security early and something unexpected comes up where you do end up making more than that $1,630 per month threshold number, you don't lose the money forever. What Social Security does is they start to prorate a portion of your back into your benefit amount once you hit your full retirement age. So if they withhold, say, $10,000 from you, they'll give you an extra $20 per month once you hit your full retirement age to make up for it. But Full retirement age, no more earnings test. If you're going to collect before then and work, try not to make more than $1,630 per month.
I think on the flip side of that, getting it before your pre-retirement age, if you're older than 67 and not taking Social Security, there's a benefit there too, correct?
That's correct. So if you wait past your full retirement age to begin collecting, your benefit will grow a guaranteed 8% per year until age 70. All right. So it stops at age 70. So never wait past age 70 to be collecting. And enrollment in Social Security is not automatic at 70. So I was actually meeting with a physician one time. He was 72 years old. He said, Mike, when should I start collecting my Social Security benefits? And I said, well, you should have started collecting it 2 years ago because it doesn't continue to increase anymore. And so he called up Social Security, and the most that they would lump sum him back was 6 months worth of missed payments. So he missed out on a 1.5 years worth of Social Security checks because he waited too long. So point is, never wait past age 70. And so it goes up 8% per year, but your benefit does increase month by month. So if you just continue to delay month by month, it will increase every single month 1/12 of 8%.
That 8% is not a bad return, especially when it's guaranteed.
No, yeah, not at all. And so a lot of retirees I meet with, one of the questions they ask is, well, should I delay taking Social Security and fund my early years of retirement out of my retirement accounts? And it really just depends on your situation. There is no necessarily right or wrong answer when it comes to that. But what I will say is, as of right now, Social Security is guaranteed, whereas nothing is guaranteed with your investment accounts. And I've never met a retiree who said, you know what, Mike, I just have too much guaranteed income coming in every month. I just can't sleep at night. Right. And so it's usually the ones who have too much money in the stock market that tend to get the jitters. But yes.
Absolutely. That's very true. What about any other strategies for spousal benefits? Are ex-spouses eligible and dependents? I know that's 3 different things I've asked you about there, but I know there's some special rules there too.
Yeah, so a lot to go through there. So even if you never contributed to Social Security, there might be a way for you to get benefits out of the system. Okay, and usually when I'm doing a formal presentation and I get to the slides that I'm going over, most people say, no wonder the system's going broke. So the first one is a spousal benefit. So if you are getting ready to collect your Social Security, even if you have none, and you're married, if you can collect the greater of your personal retirement benefit or 50% of your spouse's benefit. So maybe what I'll see is, once again, kind of going back to a physician, for example, they might be eligible for $3,000 per month from Social Security, and say their spouse was stay at home their entire career, so they don't have a Social Security benefit off their own record. They can actually apply and collect 50% of that spouse's benefit and receive $1,500 per month while they're living. They have to wait till their full retirement age to begin and receive 100% of that benefit amount. If they take it early, so one of the things we didn't touch on is 62 is the earliest you can actually begin collecting your Social Security if you want to. But each year you take it early, it's going to be discounted by roughly 7% per year. So if you start your spousal benefit at 62 instead of your full retirement age, there's a good chance you'll only receive about 70% of the amount that you were eligible for. Okay. Another real weird rule that comes with spousal benefits is your spouse has to be collecting their Social Security retirement benefit in order for you to collect a spousal benefit off of their record. All right. There used to be a strategy called file and suspend, where you didn't have to wait for your spouse to begin collecting their benefit. You can no longer do this anymore. That has been since thrown out the system, but it's called deemed filing. So when you go to apply for your Social Security retirement benefit, you get the greater of your personal benefit or 50% of your spouse's benefit. You're applying for both benefits at the same time. You do not have the ability to separate those two so that they work independently. You're just going to get the greater of the two benefits when you apply. There is one exception to this rule, and it's called, like everything, it's called restricted application. And restricted application is for individuals who were born before January 2nd of 1954. So it's getting phased out of the Social Security system. But if you or your spouse were born before January 2nd of 1954, you can collect your spousal benefit off of your spouse's record. You can get your 50% spousal benefit, and your personal Social Security retirement benefit will continue to grow 8% per year until you turn 70. So you can flip-flop from your spousal benefit to your increased retirement benefit. Okay, I know that's a lot to go over, but just know that if you were born before January 2nd of 54, there's something called a restricted application. Shoot me an email or give me a call and I can walk through exactly how that impacts your Social Security retirement benefits. So that is spousal benefits, just the greater of your benefit or 50% of your spouse's. You might also be eligible for a spousal benefit if you are divorced. So as long as you are married for at least 10 years and you get divorced and you do not remarry, okay, you can collect the greater of your benefit or 50% of your ex-spouse's benefit. Okay, a couple tacky things about this. I could have been married 3 times, all of which lasted 10 years or more. I could have 3 ex-spouses collecting off my record. I don't know what's happening. It doesn't negatively impact my benefit at all, but I could have 3 ex-spouses collecting off my record, or vice versa. If I wanted to collect off of one of their records, I don't get all 3. I just get 50% of whosever benefit amount I was eligible for at that time. Unlike before, though, with spousal benefits, where I said your spouse has to be collecting in order for you to take a benefit, with divorce spouse benefits, if your ex-spouse is at least age 62 and you have been divorced longer than, I believe it's 2 years, you don't have to wait for them to begin collecting their retirement benefit. You can just go ahead and start up your spousal benefit off of their record. All right. But really to highlight the key points of the ex-spousal benefits, greater of your benefit or 50% of your ex-spouse's benefit, assuming you're not remarried. And then lastly is dependent benefits. So I actually have a client who's 67, just started collecting his full Social Security benefit, and he is about to welcome his 7th child into this world. And so if you are collecting your Social Security and you have a dependent under age 18, they are eligible to receive 50% of your benefit amount through age 18, as long as they're enrolled in high school. If they became disabled prior to age 21, they can also continue to receive that benefit throughout. And so we don't run into it too often, but if you do have a dependent under age 18, maybe what we see is you might have legally adopted a child or something along those lines. They are eligible to collect 50% of your benefit amount through age 18. So lots to go over there. I hope everyone is taking notes.
Yeah. Well, I know that that dependent thing does kind of sneak up on people. That happened with my uncle. He went and applied, and he had children later in life and was shocked to know that he could get something paid to them monthly. So he was pretty excited about it, but definitely shocked.
Yeah, and so if you're in that situation and you're 66 and you're thinking about delaying collecting until 70, but you have a child who's under age 18, maybe you don't want to do that, because if you delay taking, they cannot receive a benefit until you begin collecting. So there's some break-even analysis that essentially has to happen there.
Certainly. When you look at having some other pension plans outside of just, the normal day-to-day jobs that a lot of people have, but I mean, you look at like the OPRs or the STAR system, the school teachers and all of that, does that have an impact on Social Security? Do they get that benefit? How does that work?
Yeah, and this is the most confusing part of Social Security, so bear with me. And being fortunate to be an advisor in Ohio, we are one of the few states that offer a public pension system to their teachers and public employees. And so they contribute to a separate system, pension system, instead of Social Security. And because they are contributing to the separate pension system, there are 2 rules in Social Security called the Windfall Elimination provision and government pension offset rules that state, because you have this separate pension, you may not receive or be eligible for any Social Security benefits. And so there's two scenarios really that we run into. The first is if maybe you worked for a private employer and contributed to Social Security for 10 years, so you're eligible for a Social Security benefit, but then you switch to being a public employee and you also contributed to OPERS or STRS. And so you also have this separate pension over here. What Social Security says is because you have that separate pension, you fall under the Windfall elimination provision because you also have Social Security on your own record. And so what they do is they take a look at your earnings history and they look at how many years you contributed to Social Security. If you contributed for less than 30 years, they are going to deduct a portion from your Social Security benefit. It does not impact your state pension benefits at all. It is only your Social Security benefit that's impacted. And they don't show this on your statement anywhere either. When you file, you just find out that your benefit might be $400 a month less than what you were hoping for. And so what happens is they're looking at your Social Security earnings record. If you contributed to Social Security for less than 30 years, there's going to be a windfall on your record, and it's determined by how many years you contributed to the system. Worst case scenario, if you contributed less than 20 years, the most that they will withhold from your benefit amount is about $480 per month. You will always get something from Social Security, all right? You'll never lose your full benefit, but it will be reduced. Okay, and so there are calculators on the Social Security website that you can use to figure out what that impact is. So that's the first one we run into, is you have both Social Security and a pension. The second one is government pension offset rules. This applies to individuals who have no Social Security, or they have Social Security and a pension, and they want to try and collect a spousal benefit or a survivor benefit or a dependent benefit off someone else's record, not their own record, not dependent benefits, I'm sorry, ex-spousal, spousal, or survivor benefits. So they're trying to collect a benefit off someone else's record, not their own. Government pension offset says, once again, because you have this public pension and you didn't contribute to Social Security, we're going to withhold a portion of your payment up to the whole amount. So the way they calculate that is they take 2/3 of your pension and subtract it from whatever you would have received from Social Security. And if that ends up being zero, then so be it. You don't get any benefits. And so you have a $2,000 a month survivor benefit, which we haven't talked about yet, which we can talk about shortly. But say you're eligible, your spouse passes away, and you can collect $2,000 a month from Social Security, but you have a $3,000 a month pension. So 2/3 of the $3,000 per month pension is $2,000. So 2,000 minus your 2,000 survivor benefit is zero. Unfortunately, you won't get anything from Social Security. There's been talks about changing this for a long time. Whether or not they actually do it or not is up in the air.
Well, and since you brought that up, the survivor benefits that you just mentioned, how does that work?
Yeah, so if your spouse passes away, you can collect the greater of your retirement benefit or 100% of your deceased spouse's benefit. All right. So once again, greater of your benefit or 100% of your deceased spouse's benefit. And unlike regular Social Security retirement benefits, where age 62 is the earliest you can begin collecting, you can actually start a survivor benefit up as early as age 60. But once again, each year you take it before your full retirement age, it's going to be reduced by about 7% per year. You are also eligible for a deceased spousal benefit if you were previously married for 10 years and you are divorced. So if your ex-spouse passes away and you wait until at least age 60 to get remarried, you can collect a survivor benefit off your deceased ex-spouse's record as well. So I actually ran into a client one time who was 59 and a half. They didn't know this rule. Their ex-spouse passed away. They were eligible for $2,000 a month off their record, and they got remarried at age 59 and a half. And because they remarried, they lost the ability to collect that survivor benefit. And so our recommendation to her was to temporarily get divorced for 6 months, wait until age 60, start up her survivor benefit, and then get remarried again. And so it's one of those weird loopholes where it would have worked, but she didn't actually end up going through it.
She chose love, right?
Exactly. She chose love. So With survivor benefits, one strategy that we'll often see couples use is the individual with the higher Social Security benefit will let theirs grow until age 70. So that way, if they pass away, the surviving spouse can collect 100% of that increased benefit amount. So it acts as some additional insurance, essentially.
Oh, great. Well, I run into this one all the time. Is Social Security actually taxed?
It depends. So depending on what your provisional income is, which for all you CPAs out there will love provisional income, I'm sure. It's what your adjusted gross income plus 1/2 your Social Security benefits plus any tax exempt interest. So depending on what your provisional income is, will determine how much of your Social Security is subject to income tax. So you do have to pay federal income tax on your Social Security benefits. And the most that is subject to tax is up to 85%. So say you're a high income earner, up to 85% of your Social Security will be subject to income tax from a federal standpoint. So 15% is tax-free, the other 85% you got to pay tax on. There's no state or local tax on Social Security in Ohio, Kentucky, or Indiana. If you live in a state outside of that or are planning on moving, double check your state's tax rules because some do tax a portion of your benefit amount. But when you apply, the reason I typically bring this up is because when you apply for Social Security, they do not ask you on the application if you would like to withhold anything for Social Security for taxes from your benefit amount. And if you don't, more than likely, come next April, you'll end up owing taxes. And so make sure to tell them, yes, I would like to withhold. You can choose between 7, 10, 12, or 22% federal income tax withholding from your benefit amount. And it's a really easy form you can fill out. It's called a Form W-4V, and you can change it, your tax withholding at any time. But I would encourage everyone to at least withhold a little bit from their Social Security so that they don't end up owing come next tax season.
Never a fun conversation from my end. So.
Yeah, I'm sure it's not. One of the benefits of my job, right? I don't have to pay taxes.
So when you look at receiving the benefits and all of that, and what happens if your mental capacity starts to wane a little bit? Who can help you in that process, or who's allowed to help you in that process and figuring all that out?
Yep, with Americans living longer and longer nowadays, and Alzheimer's and dementia becoming more and more common, this is something that's really important to be aware of. So with your Social Security benefit, the administration does not recognize legal estate planning documents like a durable financial power of attorney. So if you went through the appropriate estate planning process and set up these documents with your attorney, and something were to happen to you or you're no longer mentally able to manage your benefit, know that Social Security does not recognize that document. And so what happens is you need to call Social Security ahead of time, or when you fill out your application, you can do this then as well. But you can name up to 3 individuals called representative designees, and they are the ones that can actually manage your benefit for you on your behalf. So you need to make sure that you put these advanced designees down on your record ahead of time so that if something happens to you, there are individuals that can manage that benefit.
That's great. I had not heard of that before, so that's fantastic.
Yeah, they started doing that, I think, in 2018. So
okay.
it is
homework.
Yeah.
And this is the last question that I actually have for you as kind of a, from the get-go of what we came up with, but how and when should we file?
Yeah, I think that's the biggest question I typically get, right? And so 3 months before you would like to begin collecting is the earliest you can start the application process. So say you reach your full retirement age in April, and that's when you want to start your Social Security benefit. You can fill out the application in January and elect for your benefits to begin in April. And then you'll receive your first check the following month in May. And so the day you receive your check is determined based upon the day of the month you were born. I don't have my little chart in front of me, but you'll always receive your check on a Wednesday. And depending on the day of the month you were born, it will either be the 2nd, 3rd, or 4th Wednesday of every month. But 3 months before, that's the key there.
And then do people typically go to the Social Security office? I know things have been a little bit different here for the last year, but do you go to Social Security to do this? Is this a process that you step people through so they don't have to do that? How do they actually do it?
Yeah, there's 3 different ways that you can actually file. You can call the Social Security office at the 1-800 number. You're not actually filing for your benefits when you call. What they will do is they will schedule you a time to file for your benefits at a later date. So that's the first one. The second way is to actually visit your local Social Security office. And then the third way, and it's the easiest way, and I would encourage everyone to do it, is to file for your benefits online. You can file for your retirement benefits or your spousal benefits this way. You cannot file for a survivor benefit online. You do actually have to call Social Security or visit the local office in order to apply for those benefits. But yeah, it's a simple form you fill out. It takes about 25, 30 minutes or so. You click submit, and then you'll get a letter in the mail stating that your Social Security benefit, you'll begin to receive it on the date you elected.
Fantastic. That was an awful lot of information and a lot of years of experience wrapped up into those questions that you had there. So I certainly appreciate all of that. Katie, have you had anything else come in?
No, I have not. You are welcome to move right on to me.
Okay, so Mike answered every single question that was out there. That's great.
Everything. No more questions left at all. Good job, Mike.
Well, thank you very much for the opportunity. I really appreciate it. And I'll stick around for the rest of the presentation. So if things come in later, I'm happy to answer those.
Great. Thank you. All right, Nate, you're up. You ready?
All right, I'm ready.
Okay. All right. So now, since we're going to start talking about Medicare, who actually is eligible for Medicare?
Yeah, there are 3 groups of individuals that qualify for Medicare. And the first group is who we see the most often, and it's those who qualify based on their age. That's the most common one. So you are first eligible to start on Medicare at age 65, and it's the month that you turn 65. And in fact, it's actually the first of that month. So wherever your birthday falls in the month, it always goes back up to the first of that month. That's when you're first eligible to start. And I always have like 1 or 2 in the crowd that their birthday happens to be on the first of the month. If you are one of those folks, you can actually start Medicare a month earlier than your birth month. But for everybody else, it's the first of your birth month that you turn 65. That's the first group. Second group of individuals, so we have some clients that are in their 40s and 50s that are on Medicare already. And that is because they are on Social Security disability. So if someone is on disability for 24 months, they are automatically enrolled in Medicare on their 25th month. So 2 years on disability, regardless of your age, you get enrolled into Medicare as well. And the third group of individuals, we only see this just a handful of times every year, but it's again of any age, and it's those who are diagnosed with end-stage renal disease, permanent kidney failure, or ALS, Lou Gehrig's disease. A diagnosis of either of those, then you also qualify for Medicare as well.
That's interesting.
Yeah.
That's good. I'm glad that they have that ability to get some additional or some other insurance. So that's fantastic. So when you get close to this age, what do you need to do? What does Medicare say you have to do? I don't think they do it for you automatically.
Yeah, well, this is definitely a confusing time, because as soon as you hit 64, every insurance company in the world knows you're turning 65 in a year, and they are just bombarding you nonstop with phone calls and emails, and they're filling up your mailbox with advertisements. And I mean, it's a absolute bombardment of information, and it can be very confusing. I have a lot of people that they'll ask friends and family, what did you do? And they're all saying different things, and you get even more confused. So the number one thing that the biggest myth that I hear all the time is that you have to sign up for Medicare at 65. That actually is true for some individuals. It's not true for everybody. But Medicare says that if you have health insurance coverage through your employer, and this counts as if you're a spouse on the plan as well. So if you're turning 65, if you have coverage through an employer, and that employer has 20 or more employees, you do not have to sign up for Medicare at 65. Okay, a lot of the stuff that you get in the mail says that, make sure you sign up when you turn 65, but they don't go into any other explanation with the exceptions to the rule. So if you plan to keep working after age 65 and you're covered on your employer plan, you have the option to delay signing up for Medicare, and there is no penalty with delaying as long as you're covered by your employer plan. But sometimes you mentioned about if it happens automatically or not. For some people, getting enrolled into Medicare does happen automatically at age 65. So you need to be aware of that. So if you start collecting Social Security early, so if you start collecting Social Security at 62, 63, 64, you will be automatically enrolled in Medicare at age 65. But if you're not collecting Social Security and you hit 65, nothing happens. You're not going to be automatically enrolled unless you physically fill out the application to get it. So kind of a two-part answer there on that question. But bottom line is, you don't have to sign up for Medicare if you don't want to. You actually have a couple options. So option number one, stay on your company plan and delay Medicare. Option number two is turning 65. It counts as a qualifying event where you can come off of your company plan and then you can go to Medicare if you want to. So I help people do this all the time. They're turning 65, they plan to keep working, but they don't know, is Medicare better for me or is my company plan better for me? So we go through, the cost of what they're paying on their company plan. What are the benefits? Is it working for you? Is it not? And then how does that compare to Medicare? So we go over the cost and the coverage with Medicare, and then just compare the two and see which one makes the most sense.
So in that situation, everyone's answer could be different.
Absolutely. Yeah. Depends on the company plan that you're on. Some company plans, you don't pay hardly anything for it. I've seen it where you're, paying several $100s a month. I've seen, folks on really rich plans. I've seen people on really high deductibles, and it also just depends on, what kind of insurance do you need? What fits your particular needs? So yeah, it is different for everyone.
And you had mentioned this before about the penalties, that you can you can avoid the penalties if you're on another plan. If let's just say that you're not on another plan and you did not sign up for Medicare at 65, what's going to be the consequence of that?
Yeah, so there's two penalties in Medicare. There's a what they call a Part B penalty, and then there's a Part D penalty. So B as in boy, D as in dog. Part B and Part D. So Part B says, as long as you're it's related to what we just talked about. So if you decide to, when you hit 65, let's say you hit 65 and you're not covered by an employer plan, but you decide that for whatever reason that you don't sign up for Medicare for a year or more, they hit you with a 10% penalty on your Medicare premium. For every 12 months that you go without Medicare after age 65. And you pay that extra penalty every month for the rest of your life. So in order to avoid that penalty, then you either have to sign up for Medicare at 65 or stay on your company plan. You got to do one or the other. Now, the Part D penalty, so that Part D penalty, that goes a step further, and that it's a little confusing, like most of this stuff, but Medicare says that, so if you decide to stay on your company plan after age 65, that company plan, the insurance plan that you're on, it has to meet Medicare standards when it comes to prescription coverage. And there's a term that is used called creditable. So if your employer plan at work is deemed creditable, then you're fine. you won't get hit with the Part D penalty. And your employer, during the employer's open enrollment period, when you get to elect benefits, they are required to let you know whether your plans are considered creditable or not. There's usually a little one-page statement somewhere in your benefit packet. No one reads it, but it does say in there whether it's creditable or not. And then most are credible. So non-creditable employer plans are rare, but they do exist. And it's important that you find out whether your plan is considered creditable or not. Because if it's not credible, then there is a penalty that goes along with Part D, and you pay that every month for the rest of your life as well. It's a small penalty, but there's ways to avoid it. So if you ever find out you're on a non-creditable plan, there's a few strategies. Those strategies are a little too long-winded to explain today, but if you find out you're on a non-credible plan, just reach out to me and I'll walk you through those strategies. But finding out whether your plan's creditable or not is important.
Jami, I'm going to jump in really quick. We actually had 2 questions come through.
Okay.
Yeah.
First question being, for those looking to retire prior to age 65, are there options for medical coverage to bridge the gap other than just getting something in the marketplace? And then follow up to that question, can you pay for insurance premiums with an HSA?
Okay, so first question, if you're retiring under age 65, so I specialize not only in Medicare, but also for under 65, and it's really marketplace coverage. It's Obamacare, whatever you want to call it, Affordable Care Act, but the insurance marketplace on healthcare.gov, that really is the true source to find healthcare. Unfortunately, or fortunately, depending on who you are, that law has benefited a lot of folks. There's a lot of folks that do not benefit from it. There's good and bad that have come along with that. But the options are fairly limited. I see really 2 main options. You have the option to go with COBRA, which is the ability to continue your current benefits that you have through work for up to 18 months. COBRA is usually pretty expensive. But the marketplace can be expensive as well. So I help people compare those 2 to help them figure out, which one makes the most sense. Income has a big play into the marketplace plans. So sometimes if someone retires early, if you can control your income, you can actually get a pretty steep discount off of your marketplace insurance coverage. So there's a lot to it, but I help folks with that as well. And the second question was about HSAs. So when you go on to Medicare, and if you still have money left in your HSA, you can use that to pay your Medicare premiums. So there's several parts of Medicare. So there's a government side of Medicare. They call that Part A and Part B. There's a monthly premium to Part B. Right now it's $148 a month. You can use your HSA money to pay for that premium. You can use it to pay for your drug plan premium. And of course, you can use it just like you do now for co-pays and deductibles and medical expenses. The only thing that you can't use your HSA money for is if you buy a Medicare Supplement plan. There's a premium that comes along with that. I don't know why, but they don't let you use your HSA money to pay that premium. But every other premium and every other medical expense in Medicare, you can use your HSA money for.
I know that perfectly leads into your next question, Jami, but I'm going to divert just a minute and go back to the other question that came through the chat. It's regarding deceased spousal Social Security benefits. How does it work if I still work? Is there an income limit if I would like to receive this benefit?
Let's see. Well, that's a Mike question for Social Security. I don't want to speak out of turn here, but Mike, are you there?
Yeah. Could you repeat that, please?
Happy to. Let me get this pulled up. How it's regarding deceased spousal Social Security benefits.
Yeah.
How does it work if I still work? Is there an income limit if I would like to receive this benefit?
Yeah, so with survivor benefits, spousal benefits, and divorce spouse benefits, that annual earnings test that I talked about previously, where if you're working and you collect Social Security before your full retirement age, you cannot make more than that $1,630 per month limit, or they will withhold a portion of your survivor or spousal benefit. So just to be safe, you may want to wait until your full retirement age to begin collecting any of those benefits to avoid that situation completely.
Okay, thank you guys. Sorry for jumping back and forth. Jami, I'll kick it back to you.
All right.
Thank you. So when you talk about all of the Medicare, and you've kind of touched on this as you've talked throughout, there seems to be an alphabet available under Medicare and what your options are and what covers what and what are you paying for and all of that. Can you kind of talk briefly about what those options are and what it's covering?
Yeah, so I think about Medicare in two big parts. There's basically two main sides of Medicare. One side is the government, and the other side is insurance. So on the government side, so that's what they call Part A and Part B. And side note on Medicare, it's the same timeline as Social Security. So as you're planning this transition to Medicare, it's 90 days prior to that date. That's when you can start the process of applying for Medicare. So that's always your step number one in making the transition, is that you have to secure the government side of Medicare first. You have to apply for Medicare A and B, which you can do online. It's on Social Security's website, ssa.gov. So you go out there and you apply for Medicare once you're within that 90-day window. So get that secured first. It takes about 3 weeks for Medicare to process, so you want to definitely do it as early as you can. Once it's processed, they'll assign this Medicare number, and then as soon as you get that Medicare number, that's when you're allowed to take the next step, and that is trying to figure out what type of insurance plan is best for you. And that's where I come in to help people figure this stuff out. So there's basically two main options. So you have the option to go with Medicare Advantage or Medicare Supplement. And there's a lot to unpack with Advantage plans and Supplement plans, but I'll just hit the highlights on each one just so you kind of get an understanding of the general framework. So on an Advantage plan, what's really attractive about it is the monthly payment. Most of these plans don't have a monthly payment at all. It's $0 per month. So obviously very affordable, but when you're on an Advantage plan, you do pay for your medical expenses, and you pay for them in the form of a copay. So doctor visits have a copay, hospital has a copay, tests have a copay, ambulance has a copay. I mean, everything, you're paying something out of your pocket for all your medical expenses. And then very similar to the plan that you have right now, the Advantage plans have what they call a maximum out of pocket. So there is a limit that says that, you know, as you're paying copays for everything, if you ever end up meeting this, you know, paying up to this limit, then you're covered 100% for the rest of the year. And the limits on those Advantage plans are usually somewhere between $4,000 and $5,000. So it's a higher out of pocket on the Advantage. It takes a long time to get there because, you know, you're paying small copays for everything, but that would be your worst case scenario on an Advantage, is $4,000 to $5,000 out of your pocket. The Advantage plans include prescription drug coverage. So they call that Part D. So just, you know, remember D as in drugs. That's included in the Advantage plan. So they also include like some dental coverage and vision and hearing, and they include some other nice little added benefits, and they bundle it all together into one plan for no monthly payment. One of the downsides of an Advantage plan, the first is the higher out-of-pocket limit. You know, if you have a bad year, you have that $4,000 to $5,000 maximum. The other is networks of doctors and hospitals. So when you sign up for an Advantage plan, you're picking a particular insurance company, like Anthem or Humana, United Healthcare, Aetna, Medical Mutual. There's a whole list of companies. You'll get very familiar with them because they fill your mailbox every day with stuff. But whichever company you pick, you have to make sure that you're staying in their network of providers. So the folks that I talk to, when they are ready to make this transition, if they're interested in an Advantage plan, that's one of the questions that I ask is, who are the doctors that are important to you, and hospitals that are important to you? We research all these companies and we look up the networks and look up your doctors and your hospitals, and we see which one is the best match for you when it comes to your providers. Obviously, we want you to go with one that has them all in there, right? So that's kind of a crash course in Advantage plan. So no monthly premium, co-pays, you pay as you go, higher out of pocket, and you have a network of providers that you have to stay in. On the other side is Medicare Supplement. Sometimes you hear the word Medigap. So there's different language out there, but Supplement, Medigap, it's the same exact thing. But on a supplement plan, there's quite a few to choose from, but the most commonly purchased one right now is called Plan G, another letter of the alphabet. G is in girl. So with Plan G, it covers 100% of all of your medical expenses except for a very small deductible of $203. That's it. So all you do is cover the first $203 of your medical expenses, so doctor visits, any tests that they run. Once you hit $203 deductible, that's your max amount of pocket, and you're covered 100% for the rest of the year. So the out-of-pocket is really low on your medical expenses, but the trade-off here is that you pay a monthly payment for that. It's not zero like the Advantage, it's higher. So the cost of a supplement plan, it's based on your age, it's based on gender, it's based on what state you live in. Someone turning 65 in the Ohio, Kentucky, Indiana area, you're looking anywhere between like $108 to $125 a month for that plan. So that's obviously a lot higher than zero, but that's the trade-off is, you pay very little in medical expenses. Another trade-off is that when you sign up for a supplement plan, you are not limited in terms of networks of doctors and hospitals like you are on the Advantage. You are allowed to see any provider in the entire United States as long as they contract with Medicare, which about 93% of them do. So if you have any concern with, traveling a lot or spending time in another state, or maybe even own a, vacation home, or, I talk to people all the time that are retiring. They're like, I got a bucket list of, all these places that I haven't seen yet that I need to see, or my kids are kind of scattered around the United States. I want to travel a lot. There's really no concern on a supplement plan. If something happens, to you while you're traveling, with an Advantage plan, you got to be careful. If it's a true like life-threatening emergency, they'll certainly cover you. But if it's not, then you have to make sure you're in network. And if you go out of network, you're not covered at all. So network is a big difference between those two options. One of the downsides with a supplement plan is that it's just for medical expenses only. It doesn't have prescription coverage. It doesn't have the nice little bells and whistles that an Advantage plan has, like dental or vision or hearing. You have to purchase all that separately. So it's a little bit more expensive to go that route. So you do have to buy a prescription drug plan. Prescription drug plan is anywhere from $15 a month to, there's some that are a lot higher than that, but most people I talk to are somewhere between $15 and $20 a month for a drug plan. So that's a lot, all in a couple minute time span, but so that's part of the process of me helping folks talk through those options, evaluate what your needs are, what's your budget, and lay out these are your two options, and let you decide which one you think best fits your needs.
That is a ton of information. There's no doubt about that. One of the things, and Mike actually brought this up as a proposal that's on the table from a Social Security perspective, but I always hear about the donut hole.
Yeah.
And what, can you give a brief explanation of what that is? And is there any way to avoid that?
Yeah, so donut hole, it refers to prescription drug coverage in Medicare. I know we're tight on time, so I'm not going to go too deep on this, but basically Medicare and your insurance company, and it doesn't matter if you're on an Advantage plan or if you have a separate drug plan, it applies to all drug plans in Medicare across the board. And basically they keep track of how much you're spending in prescriptions, and they're also keeping track of how much the insurance is paying for your prescriptions, and they basically come up with a grand total of how much your total prescriptions are for the year. And if that, and the total, the limit changes a little bit each year, but it's right around $4,000. So if your prescription costs hit $4,000, then the co-pays that you had on your medications, those go away. And now you are in this stage where all of your prescriptions, you pay 25% across the board for all medications, generic, brand name. That's what they call the donut hole, is when you hit that point and you pay a percentage for everything. So I mean, it all has to do with the cost of your medications. Are they generic? Are they brand name? So try to go generic as best you can. But yeah, I mean, it just, everybody's different. Most people don't hit that donut hole, but I definitely have, folks that hit that. And it's been a burden for a long time. Luckily, there has been legislation over the years that have decreased the percentage. Right now it's 25%. It used to be 40, 50, 60%, even higher than that just a few years ago. And there's legislation currently to get it reduced even more. Yeah, I think that's about as much I can talk about donut hole without going too far down the rabbit hole.
Yeah, and I have one easy one and one more question that might take a little bit of an explanation, but open
Sure.
enrollment is when?
So there's the Medicare open enrollment period starting tomorrow. It's October 15th through December 7th. So that open enrollment period, that is for people who are already on Medicare that are looking to make some kind of change to their plan. So it's a common misconception. A lot of people are thinking about retiring, and they say, do I have to wait till open enrollment comes around to do that? The answer is no. So you can retire in April or May or June. That creates its own special enrollment period. So this open enrollment period coming up, every commercial that you're going to see on TV soon, it just refers to people that are already on Medicare. So that's what that enrollment period's for.
Perfect. And then my last question, Katie may have some that have come in, but my last one is, any last minute advice for someone that's approaching age 65 that is getting ready to be on Medicare?
Well, I'm a very much like a do-it-yourselfer type person, as much as my wife hates that. When I try to tackle jobs that are probably over my head, I try to give it a good shot. I try to figure it out on my own. But this is one of those areas where I strongly encourage you to get in touch with someone like myself or a licensed agent that has been doing this a while. It doesn't cost anything to work with us. There's no fees. What's in it for us is that when we help you figure this stuff out, whatever insurance company you pick, we help you get enrolled through that company, and that insurance company pays us a commission because we stepped in and helped you figure this stuff out. If you do any research in Medicare, you get quickly confused, and it has nothing to do with intelligence or anything like that. I talk to people that are way smarter than me that spend a lot of time trying to figure this out, and they just throw their hands up like, I wish I just would have talked to you earlier, because it's terribly confusing. So I encourage you to reach out. We'll walk you through it step by step so you don't miss anything, and help you make a good choice.
That's great, Nate. I appreciate that. Katie, did any other questions come in for either Kate or Mike? Nate or Mike?
We did have one more question come in, but I actually reached out to that individual and told them I would send an email to Nate and her afterwards, and she said that was fine. So
okay. I'll be on the lookout.
Oh, perfect. So Mike, any final thoughts from you before we close it out?
No final thoughts, but just kind of like Nate alluded to before, if you have Social Security questions as well, or retirement planning questions, we do not charge to sit together and just talk about what's best for your situation. All of the advisors at HORAN are fiduciaries as well. So we're held to the highest standard that you can be held accountable to in the financial services industry. So don't let cost or anything deter you if you have a question.
Fantastic. Thank you guys so much. A huge thank you to HORAN for partnering.
Yeah.
Nate, Mike, you guys have been fantastic. And to Jami, thank you so much for moderating. Very much appreciate that. And like I said, this event was recorded, so we will send out the recording link either later on today or first thing tomorrow morning. And we will include the contact information for Jami, Nate, and Mike. I hope everybody has a great rest of your day, and thank you for joining us.
Thank
you very
you.
much.
Thank you.
Appreciate
Thanks,
it.
guys.